Back to the Minister. Speaker, it's time for another chapter in the adventures of Steiny Brown in Ontario land. During his modelling briefing on April 16, which called for the most recent round of restrictions, Dr. Steiny Brown said that under the strictest measures, Ontario will peak around April 28 with 7,000 daily cases. Strictest measures were not implemented because almost every police force in the province thwarted this government's attempt to impose martial law. But on April 28th, despite looser measures, if that's even possible, Ontario reported under 3,500 daily cases, or less than half than Dr. Steiny Brown predicted. It's on the basis of Brown's and the Ontario Science Table faulty modelling that millions of lives are being ruined daily, including those of 3 million children and youth referenced in the letter by Ontario Soccer. So why does the minister continue to make far-reaching decisions based on junk modelling instead of firing Steiny Brown and the Ontario Science Table for being wrong time and time again?
Minister of Health.
Thank you very much, Speaker. Well, I'm not sure why the member is ridiculing the efforts of some of the medical experts that are providing us with advice, but we are receiving advice for a number of people who are epidemiologists who understand the issues here. They are providing us with their best advice with respect to levels of transmission, what we can expect in terms of hospitalization, intensive care units. We have acted on the basis of the advice that we've received. We've built up our capacity in our hospitals. We've started our vaccination program. We've extended 50% of our doses from each allocation to go into the hotspot areas. We take very seriously the medical advice that we've been receiving since the beginning of this pandemic, and we will continue to do so.